This is a CJSON podcast and I am Mara Ibrahim, a clinical research fellow at NHS Blood and Transplant in the UK. Kidney donation rates have roughly doubled in the UK over the last 10 years. The major reason for this has been the use of kidneys from older, more marginal donors and from DCD donors. However, kidneys from older donors are more likely to have some adverse outcomes which can be devastating for recipients. Dual kidney transplantation has been used as a method to overcome some of these problems. Given this evolving landscape with changing donor demographics, deciding which kidneys from which donors should be implanted as single transplants, as dual transplants, or should be discarded is challenging. In this study, we set out to explore what the outcomes of dual kidney transplants were in the UK compared to single kidney transplants from deceased donors aged 60 years and above. We examined UK transplant registry data from 2005 to 2017 to compare dual and single kidney transplant cohorts. During the study period, 7,841 kidneys were procured from DBD and DCD donors aged 60 years and above. Of these, 356 dual and 5,032 single kidneys were transplanted. 1,338, so 17% of these kidneys were discarded. Our study demonstrated 5-year death-censored graft survival in dual kidney transplant recipients of 81% compared to 84% in the single kidney transplant cohort. For functioning grafts, dual transplants had superior outcomes at 1 year and 3 years post-transplantation compared to single kidney transplants from similar donor age groups. 5-year patient survival was similar in both cohorts despite an older recipient age in the dual kidney transplant cohort. This study provides reassurance that dual kidney transplantation can result in good outcomes when using kidneys from older donors. From a utilization perspective, dual kidney transplantation may help reduce the unnecessary discard of kidneys, particularly of those perceived to be of lower quality. The outcomes demonstrated, however, also raises the question of whether these kidneys could have been implanted as singles, thereby benefiting 2 recipients instead of 1. In conclusion, our study found that recipients of kidneys from donors aged 60 years and above have similar 5-year graft survival and better graft function at 12 years with dual compared to single deceased donor kidney transplants, and supports the use of dual kidney transplantation for carefully selected donors and recipients. Thank you.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.